Welcome to Healthcare in Hawaii. I'm Josh Green, your senator from Big Island and ER physician. Did my training in family practice, and today I have really a luxury for me. I'm going to be speaking with a colleague, Dr. Dale Glenn. Dale's a healthcare leader here in our state of Hawaii. He's affiliated with Hawai'i Pacific Health, and today we're going to learn what medicine really is like in its transformation on the ground. We've had a lot of guests over the last couple months talking about the Affordable Care Act, the Healthcare Exchange. We had Beth Geesting from the governor's office and leadership from HMSA. But today we have someone who really is in the trenches, who's actually implementing that healthcare transformation and making healthcare better for the state of Hawaii. Dale grew up in Idaho, came to Hawaii because there were 9 months of winter there, has a wife and 3 kids. He's really devoted to our state, and he does an extraordinary job at Hawai'i Pacific Health integrating healthcare. He's family practice trained. He also is the chief of family medicine at Straub, which is really quite a prestigious title. He wouldn't like me to say that because he's a very down-to-earth kind of guy, but I do want to put that in perspective, that he's providing a leadership role here in our state on healthcare transformation and making healthcare better for you. So I want Dale to tell us a little bit about himself, and then we're going to dive into healthcare transformation today. So Dale, thanks for coming on my show.
Thanks, Josh. Glad to be here.
It's great.
This is a privilege, and it's always fun to talk about healthcare and the new things that are happening here in Hawaii.
Well, you have a great perspective. So what I wanted to start off with was tell us a little bit, well, first tell us a little bit more about yourself. You are a family practice physician, is that right?
Yeah.
Why don't you tell people again what that means? Because I know people have heard physician, but they sometimes don't distinguish internal medicine from family practice from other disciplines.
Well, you know, in family medicine, I think we think of ourselves as the jack of all trades, master of none, right?
Yeah.
It's like 90% of the things that would come in off the street, I could probably at least tell you something about and treat a lot of them. Right. So it's birth to death care. We take all ages. Some family docs even deliver babies here in Hawaii. So there's a lot of variety in training, and family docs work in a variety of different settings. We've got docs one doc practices on Kauai, a couple of docs on Lanai who cover the emergency room as well. You do a lot of ER work, and you're trained in family medicine. So right. It's sort of a specialty that gives you a wide variety in medicine.
It does, and I think that it's very important for people to recognize that in many ways family practice is kind of an essential piece of our healthcare system now more than ever because of all this discussion about patient-centered medical home. Would you like to mention patient-centered medical home and what that means to you? We've had other people talk about it more abstractly, but you're kind of doing it. So what does that mean to Dr. Glenn and Hawai'i Pacific Health?
Sure, you know, and especially for patients and people who are out there trying to get care. Family medicine is changing. It's changed dramatically over the last 5 years, and it's changing even more. But really what's changing, it's changing in the larger context of healthcare. Probably the biggest change we're seeing is this new team approach to healthcare, and that's really what the patient-centered medical home is. It used to be if you had a healthcare problem, you went and saw a doctor when you got sick.
Right.
But in this new model, in order to reduce the cost of care and actually help us keep people healthy and out of the hospital, we're practicing more as teams now. So I have a group of nurses who I work with who actually will look at a list of patients who have diabetes, find out who's overdue for getting their diabetes checked or their blood pressure checked, and call them to have them come in. So we can actually catch these things before they become a problem. So the patient-centered medical home is about delivering all the care you need in one place. It's about focusing on prevention, and it uses sort of a team approach where the physician is the captain and not just the person doing all the care like it used to be.
Got it. What are you seeing? Are you seeing better results already in your practice? You know, I think that later on I want you to reflect on what healthcare used to look like and what it will look like in the future, but just kind of as we first dive into this issue, we hear people saying it's supposed to control cost and provide better care, you know, and better satisfaction, the classic triple aim.
Sure.
Is it happening? Are you experiencing that?
Yeah, and we can actually see the numbers because we try to measure our success. It definitely is delivering better care in a lot of ways. First of all, we see improvements in the numbers for a lot of our patients with diabetes. You know, we see A1Cs going down, and A1C is a measure of how sick someone is, of how bad their diabetes is.
Right.
We see blood pressure numbers getting better. But more importantly, we find, you know, on a one-on-one basis, we're actually changing lives.
Interesting.
Okay? And let me just give you an example of how this works.
Excellent.
Right? So I had a case in my office, and this is where the team approach really makes a difference, okay? Because I had one of my patients come in, and we talked about getting a colonoscopy. Now, that's probably not at the top of your list of things to do either, right?
No,
you know, I think we all, you know, I don't think you and I are quite there yet anyway, but, you know, that's an age where we're all sort of dreading that point.
Right.
But so I talked to this patient and said, you know, it'd really be a good idea if you got a colonoscopy to screen for cancer.
Mm-hmm.
Patient really didn't want to do it. Well, we have these little new stool cards, we could do that. Well, patient didn't want to do that either. So I walked out, and one of our team members, one of our care coordinators walked in.
Right.
And I don't know what kind of a speech she's got, but she came out with permission to do the colonoscopy. And in this particular case, the patient actually turned out to have cancer.
Wow.
But we caught it early, and so it was kind of a life-changing thing. And we, the practice got a nice bouquet of flowers from the patient. But to us, that's what this is really all about. It's about the baseball games that people will be able to attend and the family outings that they're going to have that wouldn't have happened if we had not changed our approach to healthcare.
I really appreciate that story, because I think as we've had these abstract conversations about, the numbers are slightly better, or we've got slightly more screenings out into the community, that does sound good, but to imagine an individual, you catching their cancer early, I assume that they didn't have to have quite, well, they certainly didn't have the tragic outcome of passing away.
Right.
And very likely, I suppose, they'll need much less chemotherapy or radiation or whatever. I don't want to get into their private matter. But,
understood.
But they will probably have a much easier road going forward, which really takes its toll on them and the healthcare system.
And that's really it's the human cost that we don't really think about. Okay, we talk about the money, we talk about the cost of healthcare, but it's when you think about the most expensive things in healthcare, things like cancer care, like chemotherapy, end-of-life care, hospice care. Really, if we did a better job in delivering those services the right way,
yes,
they actually tend to get less expensive. But what's more important is families actually have a better experience.
Right.
By reducing the number of people who have to go through chemotherapy or get cancer, or the families who don't have to spend their last few days in an ICU,
right,
we actually improve the experience of care, and patients live a better life.
It sounds like actually kind of that the system that you're creating at Hawaii Pacific Health in many ways is, I guess, reflective of what we were trained as family practitioners, where we were supposed to take care of the whole patient. We were supposed to be there for them in all facets of life. But from my experience, the healthcare system got so complicated, it became difficult for us to do that in our 12 minutes or 8 minutes with a patient. So now you have your team, and they were able to get that guy colonoscopy and essentially helped him through it.
Right, and see what happens in that case is, with the team approach, the team, back in the day, it was one doctor, one patient, right? And you took care of whatever that patient needed. But as medicines become more and more complicated, there are so many more drugs now, there are more procedures, there's a lot more you have to know.
Right.
And there's also all the billing and coding and all the regulations. It's become much more complicated. Well, we're actually moving that pendulum back the other direction, because by using new technology like the electronic medical record and some of the new techniques like the patient-centered medical home, we can actually take some of the busy work away from the doctor, giving you more time to spend with your patient. So that's what we got into medicine for, right? It was to heal people.
Yeah.
And so what we want to do is spend our time face to face. But I do spend some of my time kind of stepping back, looking at the population, everybody who's in my practice, saying, all right, how healthy are they?
Yes.
How many of them are getting their cancer screening? How many of them are getting checked for heart disease? How many of them are getting their bone density scans?
Right.
And 5 years ago, we didn't have those numbers. We didn't have any idea who was in our practice or how healthy they were until they walked through the door, right? They come in, if they're sick, we treat them, right?
Right.
But how do we keep them well? And unfortunately, without these kinds of tools, you can't keep people well.
I totally agree with you, because when I was in primary care practice, which was my first job out of residency, from 2000 to 2004 at the Community Health Center, I can tell you I didn't have the first clue about how many of my individual patients had uncontrolled diabetes, how many had uncontrolled high blood pressure, how many people did or didn't get their screening. I just every morning had a list of 20 or 30 patients.
Right.
I was going to race through them and do whatever I possibly could to deal with their acute problems, some of the issues that had come up in their lives, and then maybe if there was a minute left, I might remember to say, hey, have you had your mammogram? Have you thought about getting your flu shot? Have you thought about making sure that you get your routine blood test? So little time. But even then, even if we did those tests, I had no mechanism to go back and say, okay, 70% of our practice now has their blood pressure controlled.
That's right.
And so really what you're doing is cutting edge, and I think that is fantastic. I want to dive more into that in our next segment, but I thought here in the beginning, if you could give us a little bit of an overview of Hawaii Pacific Health, just so people out there who might be familiar with just one of your hospitals but not the others, they can get an idea, because you're really a very comprehensive healthcare system for the state of Hawaii. So could you tell us a little bit Dale, where the hospitals are, what makes up Hawaii Pacific Health, just so I can have a better feel for that.
Sure. I think Hawaii Pacific Health is the biggest organization that nobody's ever heard of, right? Yeah, it's the parent organization because 10 years ago, we saw what was happening in healthcare with all these trends and realizing that, having all these different acute care hospitals going their own way was resulting in too much overhead, too much expense, and they weren't going to survive.
Yes.
So Straub, Kapiolani, Palimomi, and Wilcox on Kauai all merged together to form one system we called Hawaii Pacific Health.
Okay.
So in addition to the 4 hospitals, we've got 49 different outpatient clinics.
Wow.
On Kauai, Oahu, and we have the island of Lanai too. So we provide the majority of care on those areas, actually.
That's amazing. And so 49 clinics in addition to the hospital. So you said Straub, Kapiolani, Palimomi, and Wilcox.
Right, and a lot of those 49 clinics are specialty clinics at Straub, but that we have at least, I lose count, I think about 12 independent satellites.
Okay, so so people out there who might not be familiar with health systems get the idea, not only do you have the 4 hospitals and the multiple clinics, but people can have which insurances and come see the physicians at these
Pretty
facilities?
much any insurance. I mean, we take everything. We're not a system like Kaiser, and Kaiser's another entity here, but we don't have our own insurance plan. So we accept pretty much any insurance. Okay,
so someone's got HMSA insurance, UHA, or whatever, and they're able to choose their doctors. And is it because they have a preference of your doctors, or because they live nearby, or
it's both, actually. I mean, one of the things that makes our system different is we are the people in your neighborhood. I mean, our facilities are we have large facilities around Oahu, and we also have satellite clinics in most neighborhoods, most areas. Okay. So usually there's one of our facilities nearby. In addition to that, we've got over 200 physicians using our electronic medical record, so they're connected to us electronically. And we also have, we'll talk a little bit later about what PHOs are and how the system is being built. But the point is that wherever you are within the system, even if you're seeing an independent physician who just happens to be affiliated with us, your record's going to go with you. So if you had an x-ray done at Kapiolani, or you had a film done over at Straub, and you're in your doctor's office, we're going to be able to pull those films out and look at them together.
Very interesting. Yeah, I've noticed that Hawaii Pacific Health is really at the cutting edge of a lot of this kind of coordination of care, which I know it's a buzzword, and many of my previous guests have talked about it, but it's interesting to see and hear you describe it, so that a doctor who is at their own office or whatever, if they have some affiliation, they can talk to an oncologist at Straub, or they can talk to another provider, and they can transmit some of the notes and their x-rays and so on. So really we're starting to form a system that really is pretty integrated, it sounds like.
Well, and I'll tell you, even, we tried to have an integrated model several years ago, right? But believe it or not, Josh, my first job in college was actually driving the van at Straub to take charts from clinic to clinic all around the island, right? And so we'd have these paper charts that were like, this thick, and we'd have to fly them in between the islands too for our specialists, right? And sometimes the patient would get there before the chart did. So the patient would show up, you'd have no information on how to treat them. With the new systems that we have now and the new technology in place, coordination of care is all about getting the information where it needs to be. Sometimes I like to tell the medical students that information is the indoor plumbing of medicine, right? You turn on the tap and there it is, and if you don't have it, you've got to go haul water from somewhere. But what that allows me as a physician to do is provide better care for patients, and it really changes the experience for patients as well, right? Let me just give you another example. I was on the island of Lanai. We've only got 2 docs there, right? Small clinic, and we have, of course, the Lanai Community Hospital there too. I had a family that brought in a newborn baby, just maybe a week old. Okay, and the baby was jaundiced. That means the skin was kind of yellow, eyes a little bit yellow, and it can be a serious condition, of course, as you know, if it gets bad. And they'd been told by another person they really needed to fly the child to Oahu because they were concerned about the degree of yelling. Well, as it turned out, the child was actually born at Queens, which is not part of our system, but Queens, we have a link with their electronic medical record too. So I was able to pull up the birth record for this child, even though I'm on Lanai, look at the lab report from that birth, compare it with the lab report we got in the office, and determine the child was actually getting better. And so with just a little minimal help there and the help of this record, we saved them a flight. We were able to reassure the family, so the panic went away. They were very concerned. And I've got, I can tell you hundreds of stories like this where coordination of care is simply so much better because we had the information where we needed, or I could send information to another physician rapidly and quickly.
It sounds like you're right in the middle of this healthcare transformation, and probably we've been in medicine now 15 years or so. When we're reflecting 15 years from now, the next generation...
start adding up our age, okay?
Well, the next generation is going to say, what, you didn't have a fully integrated system, how could you have functioned? But I'm so glad that you're a trailblazer in this area.
Did you remember when you got your first computer in healthcare?
I do remember.
I mean, when I came to Straub, in 2000, right, there were no computers, right? Physicians didn't have computers. We actually, the internet was there, but we couldn't look up information. And so those of us who were just coming out of residency, who had learned a little bit about how to use the internet, were kind of going, well, how are we supposed to practice, right? And it was the beginning of this transformation in healthcare. So you and I have kind of lived through that a little bit.
And it's going to now be cell phones and iPads. And let's take our first break here, Dale. And then when we come back, I think we're going to dive into healthcare transformation, what it means to you and what it means to Straub. We're going to start exploring the physician health organization you're putting together so that you can really tell us what it's going to look like for Hawaii Pacific Health. Sounds okay?
Great, Josh. Okay. Sounds good.
Again, I have Dr. Dale Glenn here. I'm so happy to have a fellow physician on the program. I'm your host, Josh Green, for Healthcare in Hawaii.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Dr. Josh Green, Chairman of the Senate Health Committee and a doc on Big Island. Today I have Dr. Dale Glenn, who's a friend, who works over at Hawaii Pacific Health and who's a leader in healthcare transformation. In our first 15-minute segment, Dale was able to give us an overview of what Hawaii Pacific Health encompasses as a healthcare system, how they integrate healthcare amongst several hundred physicians, and how they're actually improving healthcare on the ground for the people of Hawaii. But I thought because I had the opportunity of having a healthcare leader that's actually a physician also at the same time here on our program today, we could ask him what's it going to be like for healthcare transformation for the independent physicians that are part of Hawaii Pacific Health's network. How are they going to implement it? We've had a lot of philosophical conversations on this subject, but he's really in the trenches. So I wanted to turn it back over to you, Dale, and ask, what is healthcare reform? What does it mean to you? There's so many acronyms out there. We're hearing about the Affordable Care Act, the ACA, ACOs, the Accountable Care Organizations, all these letters. We talked about PCMH, Patient-Centered Medical Home, which you spoke very eloquently about. What is Hawaii Pacific Health doing, and what's their kind of vision for healthcare going forward?
Well, when you think about healthcare, Josh, there's this triangle of patients, people who need care, providers like you and me who are supposed to help, take care of people, and then there's the people who have to pay the bills, the payers. So everybody's got a stake in this healthcare game and in trying to help make it better at hopefully a reduced cost.
Right.
So what we're looking at is how do you take the best of what we have here in Hawaii in terms of facilities and physicians and create a system that's actually better for people, that's friendlier, that's easier to access, that creates better quality at a reduced cost. So, as I mentioned earlier, we have 4 hospitals, we have 49 outpatient clinics, we have over 1,000 affiliated physicians who work with us.
Right.
And what we're creating is a network among those pieces that's actually a lot tighter. Okay, when you talk about something called a PHO or a physician hospital organization, 5 years ago, healthcare was very fragmented. Physicians really practiced in silos. And so the big question we face now is, these independent physicians really value their independence. They wanted to become, a solo practice or independent docs for a reason. Right. And so the question comes is, as medicine makes this big shift towards a team-based model, a coordinated care model, do they have to sell their souls to corporate medicine? Do they basically have to give up this idea of being independent and having being able to make their own decisions to become part of a large organization? And our argument is no, that you don't have to, okay? That you do have to work with a team. If you're going to give your patients the best of care, solo practice is not the best way. Just by itself, working solely by yourself is not the way to do it, okay? You're not going to be able to provide, no one person can provide everything another person needs, okay? So healthcare is best delivered by teams or networks. However, just because you decide to become part of a team or a network doesn't mean you have to give up your independence. You can still remain independent financially. You still make the decisions on what kind of care your patient gets. So what does being part of a physician hospital organization like Hawai'i Health Partners, which is our organization, where I
that's the
serve
name of
that's the name
physician.
of it, yeah.
Okay.
So Hawai'i Health Partners is where I serve as the medical director. And what we've done then is we've tried to help unite physicians and hospitals together and create some new capabilities. And some of these new capabilities include things like outreach teams. All right, we have a team that actually will contact patients who may be due for care. All right, so whether they due for a diabetes check or a cancer screening, or maybe they just need their labs checked, or they haven't seen the doctor in a while. We have teams that deal with complex care. Unfortunately, in the fragmented days, if you were sick and you came to see a doctor, that may be the only time you see them, and that may be only when you're in the doctor's office would you actually get care, right? Now we'll actually send someone to your front door if you haven't been seen in a while to make sure you're doing okay. We'll have somebody check up on you and make sure that your lab levels are okay. And we found that by doing that, we keep people out of the hospital. By keeping people out of the hospital, we reduce the cost of care. So better care is actually cheaper. And it seems to be most effective when it's delivered by teams.
And have you gotten, it's such an interesting thing, because it really has flipped the system philosophy on its head from the old days, so to speak. Have you found resistance amongst, well, you're a hospital partner, but do you get concern from your hospital team saying, hey, wait a second, we rely on some of the work we do at the hospitals?
Absolutely. It's funny because this healthcare transformation, I think, produces fear on a lot of sides. Patients are afraid of losing their insurance or their doctor.
Right.
Hospitals are afraid of losing their income.
Right.
Physicians are afraid of losing their independence.
Right.
Really, I think there is we can create a win-win situation for everybody if we do it the right way.
Yes.
And so what partnerships like this do then is try and help bring the hospitals, the physicians, and the patients together.
Right. I think it's so necessary because, first of all, times have changed. The days of just going into the hospital and staying there for 2 months and getting better but convalescing there,
Right.
those days are kind of passed behind us. And with increased scrutiny on the healthcare system and, of course, the Affordable Care Act and many of the new rules that have come in with it on hospital readmissions and whatever, I think that everyone's finally it's like awakened a sleeping giant. And so people like you and myself, to some degree, we're put into a situation where we're finally asked, okay, really do it. So it's interesting to hear about these teams that you're sending out. Now, where are you recruiting people from? Are these local people that you've been able to train in healthcare? I'm interested in what qualifications you've been seeking to have the best people.
Well, and they're all local people. And talking about different teams, like for the physician team, we have independent physicians who are in their own practices,
Right.
who work with our system. We've hired medical assistants and nurses, all from the local community. Yes. But we have to train them specifically to practice in a slightly different way. Again, they're used to practicing in an office-based setting.
Right.
We want them to start learning to practice medicine over the phone, using the computer, and sometimes face-to-face in a patient's home. And that's not how we were trained in medical school, right? I mean, were house calls covered in your curriculum?
Not very much. Although I'll tell you, when I moved to Ka'u, I was only doc for a big, gigantic geographic area, and I used to do house calls always on the way home, and it was really gratifying, actually. I never had my act together to fill out the paperwork properly to bill these things, and I never cared. I was, just working.
You're there to take care of people, right? Yeah.
But it was really satisfying to know that, and people loved it. They loved when you came and dropped off, their antibiotics after talking to them on the telephone, but also listened to their lungs, or if you came in and you just checked to see how they were living. And I had a lot of people that also decided to pass away at home when they had some very severe illness, and we were able to provide hospice care at home. And I would just come in kind of as a social visitor because they had their hospice team. But those kind of things really, I think, will change the healthcare system. So you're doing it on a big level, though.
Yeah, and see, when, in practice, I did the same things with my patients in Kailua, and still do on occasion. But the truth is, you and I can only visit so many houses in a given period of time.
Right.
With the team approach and using the technology, we can send a number of nurses out to homes, or we can do virtual visits. We can talk to patients over the phone, but have their electronic medical record right there, look at their information. We even do some in-home monitoring, checking blood pressure, weights, things like that, in-home for some of our sicker patients, to make sure that we find out early if they're starting to turn the corner and go the wrong direction. So the team approach allows us to make virtual house calls, kind of expands your ability as a physician to reach out to more people.
So tell me a little bit more about the the PHO that you're forming. You're reaching out to people, they're coming aboard, they're becoming more inclusive. Is this an approach so that we have enough doctors to kind of all be partners, because we need partnerships from all the multiple specialties? I mean, are you finding it difficult to get, docs like us can be stubborn, right?
Mm-hmm. Sure.
Is it difficult to change people's kind of hearts and minds to engage in this team concept and look at things differently? What's your experience?
I think change is always a little scary for people. Mm-hmm. There's definitely been some fear, I think, on the part of everyone. And we're starting out this organization with about 500 physicians who are employed, because I think they didn't, they kind of know what the system is, right?
Sure.
But then we have about 20 or 30 specialists and independent primary care docs who are also working with us, who've decided to be the brave ones to go ahead and try out this new model and see how it works.
Right.
But I think there's always concerns, again, about the things that I mentioned earlier. Will they be able to maintain their income? Most importantly, will they be able to give the care they want to? Yeah. We don't want to go back to the HMO days where everybody felt like, the care was being run by accountants, right? And that they would simply tell you can't give care, you can't do this. This is not like that. This is different. It's about preventative care. Not about stopping people from getting what they need, but deciding what they need before it becomes serious. That's the change.
This sounds like a reflection of the Affordable Care Act, because I know for all of the concern people had about the Affordable Care Act, or Obamacare, as some people put it, when I reviewed that bill, and I read that bill page to page all the way through.
You're one of the few. It's pretty complex.
Well, I have that double life, so I was forced to read it, and I was gratified to read it, because when you dig into that bill, even though there are some things that you and I might disagree philosophically about the bill. I know you and I think very similarly about most of these health issues. It did continue to harken back to prevention, to providing more and better care for people before they get severely ill, and to put resources into training, into community health centers, into accountable care organizations, which are some of the things that you're kind of touching on.
Yeah.
And really it was meant to flip the healthcare system, much like you're flipping the healthcare system, towards primary prevention and better wellness. So I'm glad to see that it's actually translating into a real effort here in the state of Hawaii. You seem to be leaders. Are other people doing this around the country? What are you seeing?
Definitely. In fact, we just saw some studies that came out this week that talked about the results of a lot of patient-centered medical home study programs nationwide that showed, in fact, there is a reduction in cost. People seem to be getting better care, but what's more important is patients are happier with the care. They like it. The Affordable Care Act gave us a foundation to start a lot of these experiments and projects to try and prove that these concepts actually work.
Right.
But at the end of the day, what's going to change healthcare is, quite frankly, you and me. It's people delivering care who are going to have to actually change how we practice.
Right.
Hospitals are going to have to change how they think. It's got to change at the ground level for us to really save money and deliver the kind of quality that our friends and family deserve.
Well, I would tell you this. One thing I often say to docs is, there's so much work to go around, though I know there's fear about change, and we see, Hawaii Pacific Health doing something very dynamic, and over the years we've seen Kaiser take on projects and Queens take on projects, but I don't think people should be too worried if they're a physician or a nurse, because I'll tell you what, I've seen all of my colleagues and you be totally busy all of the time with an ever-increasing capacity to provide more care for people. There's that pent-up demand for people to get care.
Definitely.
And so I guess I would tell people, don't be shy. Dive in with your program or the other programs to really engage on healthcare reform, because doctors aren't going away, nurses aren't going away, the need is there, and people appreciate what you do. So I'm glad to hear that you're really taking the bull by the horns. What do people do if a doc wants to join the physician hospital organization? Do they contact you? Do they contact Straub directly? How's it best done?
They could do it either way. They could contact Straub and ask about Hawai'i Health Partners. They could certainly contact me, and I can leave contact information if you need it.
Sure.
But let me get back to your question a little bit and talk about just the fear.
Yes.
I think that us as physicians, we're afraid our jobs are going to be taken over by computers, right? Or maybe the nurses will be doing everything doctors do now.
Right.
And as you said, I think we need to worry about that less. Because as it turns out, there were some studies published a few years ago by the Center for Disease Control that said for a primary care doctor to do all the preventative care that they should be doing for an average practice of 2,000 people would take 21 hours a day. Now, I don't know about you, but I like to sleep.
It's about one more hour than we've been working, so
just about.
Yeah.
But about 10 hours less than we're getting paid for, right?
Yes. Yeah.
But we want to see that transformation occur in such a way that we bring other people in to help take on that load. And so what happens is we're finding we need less expensive technology, you know, less CT scans, MRIs, that kind of thing, and more people on the front lines. So there are a lot of jobs available. There's a lot of sort of a renewed interest in what healthcare can be, and it's engaging a lot more people in this mission of preventative health.
I think that's terrific because one of the hopes I've always had for this program is that we don't only serve as a health literacy opportunity, which is kind of what you and I are trying to do today, but also to show people like the Chamber and others that this is a major growth area for people. I want young people from Kona and Ka'u and Kailua and Hana and all across the state to know, go into healthcare professions. Either get a business degree and go into healthcare, or go get a nursing degree or a medical degree and dive in clinically. But there's so many opportunities. I see this as the place. We have tourism always right here for Hawaii, thank goodness. But we have ag also, which is a key for our state. But we have healthcare as well. And I think healthcare is going to be, in many ways, the economic driver for us going forward.
Well, and healthcare can be an economic driver in two ways. Okay, I think it could definitely be a growth industry for Hawaii.
Yes.
I think a lot of people come to Hawaii because of our, clean air, beautiful environment. We are known as the health state.
Right.
But on the other hand, because healthcare in general costs a lot for employers,
Yes.
if we can deliver care more effectively, we reduce the burden on our local employers, especially our small businesses, who want to stay open, but they're drowning in overhead.
Right.
If we can help them, then we've really improved the economy of our state.
I think that's a great point to take another break on. And then when we transition, I really want to ask you, since I've got you as a real healthcare provider, I want you to speculate on what healthcare was like 5 years ago, today, and then tomorrow.
Sure, that'd be great.
So that's the way we'll proceed. So again, I'm Josh Green, your host at Healthcare in Hawaii. Thanks for joining me and Dr. Glenn.
We want to thank our underwriters.
Hawaiian Electric Company and its affiliates Maui Electric on Maui and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High-Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle and Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the Gas Company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
I'm Nicole Horry. Thanks so much for joining us on Think Tech.
I'm Maria Kashem. See you next time.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, physician from Big Island and state senator. Today I'm joined by Dr. Dale Glenn, who's a terrific physician working at Hawaii Pacific Health, which is a large healthcare system of 4 hospitals, many physicians across the state. And in our first 2 15-minute segments, Dr. Glenn's been able to explain to us how they're integrating healthcare, how they're implementing the Affordable Care Act and some of its mandates, how they're actually creating a system that is putting the physician as a part of a team, patient-centered medical home team as a captain of that team, but spreading care across many other providers to deliver better care in a more effective way, and in many cases a more cost-effective way for our businesses and our community. But because I've got a provider here today and someone who's worked in the state of Hawaii, what I wanted to do is I wanted to have Dale reflect on what healthcare was like 5 years ago and what he thinks healthcare will be like 5 years from now. Could we go that way?
Absolutely. I think it's a fun topic to talk about, actually. You think about how much technology's evolved, and quite frankly in medicine, we're a little bit slow to get on that train, right?
Right.
And when you and I started in practice, pretty much everybody had paper charts.
Right.
Okay, and now still a lot of docs do, but more and more physicians are getting away from the paper. And so that in and of itself is a huge change.
Got it.
But what really happens when you go from a paper chart to a computer-based chart is that more people are able to access that record at the same time. So that's what allows you to bring a team into the approach, because everybody can look at the same record at the same time and split up the tasks, all right? So as a physician, 5 years ago when you and I first started in practice, if whatever somebody needed, we'd have to deliver. Like you said earlier, we might have time during the visit to talk about the mammogram. We might have time to discuss, cholesterol management and weight loss. And, those things can take several hours to talk about.
Right.
Well, now in my practice, before I even walk in the room, my nurse will come in, look at the electronic medical record because she can see the chart. She might order a diabetes test. She might give a flu shot. She'll do all that stuff before I even come in. And say, for instance, one of my patients is overdue for a diabetes test. She'll actually stick their finger and do that test right there. Do an A1C, which normally has to be done in a lab. She'll leave it on the door, covered up, before I even walk in the room. So it's faster. I didn't have to send the patient to the lab, say, come back next week, all right, and then we'll go over those lab test results. We had them instantly, and then we could make a plan. And as part of that plan, because other people are sharing the record, I can then refer that patient to a nurse educator. I could send them to a personal trainer, other members of the team who then take over and do the work that I really can't do in the office. So having these other resources as a physician has really changed the way I practice.
Sure.
And then of course there's the fact that, at the end of the day, I don't have a whole pile of charts on my desk either.
That sounds very, very appealing. Tell me, so has it made you more efficient? Are you seeing more patients, or are you spending a lot more time with patients? What's your experience?
In my own practice, I think I'm actually spending more time with patients. Now, as we all know, computers can be kind of a mixed blessing, right? I mean, they can speed us up, they can slow us down. Sure. It's a tool. It's really only as smart as the person using it. And I found that some systems do a really good job of implementing the computer system, others struggle with it.
Sure.
And I think in our organization we've done a fairly good job, and I've heard a lot of good reports from both patients and physicians.
What system do you guys use?
We use the Epic system, and actually Queens and Kaiser use the same system. So fortunately we're able to all talk to each other, which is a really great thing for Hawaii, because we can move those records wherever you need to go.
Yeah, I'll tell you, I really appreciate that you guys did that, because I know that the big state initiatives, as you're aware, we of course have the Health Connector, trying to get people insured, which is one issue that we've spoken about. But the Health Information Exchange is dependent. It's going to be dependent. And actually, I think you guys have been leaders of the Health Information Exchange. If I'm not mistaken, a member from Hawaii Pacific Health has been the chairperson of the group.
We've been heavily involved in that effort.
Right, and I think that our viewers are interested to know that we're always going to be focused on privacy and security.
Absolutely.
But at the same time, we want people to get the very best possible care in a timely fashion. God forbid they have an emergency, they show up at your door, and the ER or a surgeon needs to immediately be able to take account and see what's what and how we might save somebody a great deal of suffering or get right to the core. And I think that your participation in an integral way has moved that project forward much more quickly than otherwise it might have gone. I will tell you also, I'm frustrated that the Hawaii Health Systems Corporation, which does a lot of wonderful work, didn't choose a system that integrated with Hawaii Pacific Health in Queens. That I don't throw stones. I just do wonder why we aren't all able to use the same system, because I know we're now going to have some challenges to integrate them.
Well, we truly are, and as I've spent the last 10 years working on developing these systems, and people don't understand the benefits of having a system that can talk to each other. And let me give you a couple of examples. First of all, I really understand the privacy thing. I totally get that. My records are in there, my family's records are in there, and we want those protected. But people don't realize how often, unfortunately, even on a paper chart, people can peek in that chart and find out things they're not supposed to.
True.
So we knew that was happening. At least with the electronic chart, we can track that. So we know if somebody's been in there who isn't supposed to. So that's one thing. The second thing is that patients don't realize how much power it gives them, because I hate to say it, but when we as physicians in a healthcare system control all the records, you as a patient may not be able to get the information you want when you need it. With our system, our patients are getting access with their iPhones and their Androids. They can make their appointments on their phone. They can refill their medications. They can look up their kids' shots on their phone. They can read their lab tests. All of our patients, when they have a lab test done, those results are emailed to them immediately, even before I see them. So this idea of health information exchange is really about giving people control over their own healthcare information. They can take it anywhere they want to, even if it's on their cell phone. So it's about a lot more than just even allowing us to talk to each other as physicians. The privacy is important, but what it's really about is access, and especially giving you as a person access to your family's information if you need it.
Right.
Say you're going outside our system and you're going to see someone who's not connected. Well, if you're connected, you can carry that information with you very easily or pull it up when you need it. So it completely changes the interaction between myself and my patients. And it also changes the experience for patients. I'll give you another quick example.
Sure.
Physicians are scared to death of email.
Yeah.
Okay, I mean, Facebook, Twitter, all this kind of stuff. We don't want personal health information ending up in the public eye.
Right.
But at the same time, as I've started using our secure email system with my patients, our relationship has changed. I find I'm able to monitor their care outside the office, and we maintain that relationship even when they're not here for an office visit. And one of the most common emails I get from patients is thank you. They write in and say, gee, Dr. Glenn, I exercised today. Dr. Glenn, I lost 10 pounds. I'm feeling really good. Dr. Glenn, the pills that you gave me worked really well. Now, once in a while, they have questions that need answering, and if I can do that by email, I will. If not, I may ask them to come in.
Right.
But it's dramatically improved the way I communicate with my patients when you can have this kind of information exchange. But we really need all health systems and all physicians and providers in Hawaii to share information for that to really work for the people of the state the way we need it to.
Yes.
Back in the day, Apple and Windows, right? I mean, they just didn't talk to each other. Nowadays, it's a little bit better, but still, you can't always open files on your Mac that you created on your PC, right?
Right, sure.
And unfortunately, healthcare information is the same way. The systems don't talk to each other, and even with an exchange, it's kind of a medium. It's not the same as actually being directly connected. So the closer we can integrate these systems and the quicker we can do it, the healthier we're going to be and the less money we're going to spend.
I think you're right, and I think when we had Christine Sakuda on the program, she expressed many of those same sentiments, and she, though not a clinician, had a real kind of firm grasp about what's going to be necessary to make sure that our system really integrates and that people can have that experience that you're already providing to your patients at Hawaii Pacific Health across the state. It's going to be interesting to see how that plays out when patients then are able to really choose to take their information anywhere they choose,
That's right.
Even across the system. But I think overall it's a good thing, because I think if we empower patients to better take care of themselves, only good things can come out of that.
That's right. And I think that's not something to be feared. I think physicians are a little afraid of that too. That patients can read our notes. If you and I make mistakes, people will see that. Well, we're human, and it is their information. The other thing about health information exchange is we have connections with the mainland. I can pull records from Cleveland Clinic, Cedars-Sinai, any one of hundreds of other facilities. When tourists come over or when we have patients who go to the mainland for care, it ties us into, ties the best of Hawaii into the best of what they've got in the mainland too.
Yeah.
So we sometimes feel like we're isolated out here in the middle of the ocean.
Yes.
We don't have to be. We can actually teleconference and work with physicians who are on the mainland who provide services that we don't have here.
It sounds kind of like, and bear with me here for a second, it sounds kind of like when I've had individuals from Kaiser converse with me, what they were doing, but you're the independent physician,
right.
independent system version of Kaiser. So you're integrated in a way that's based around the patient and information rather than bricks and mortar and the Kaiser model.
Exactly.
Yet you still are doing these things and allowing your physicians to remain independent. Is that a fair characterization?
Yeah, and what you could say is we're electronically integrated, but we're not financially integrated. We all talk to each other, we communicate, we share information. We also share protocols and we share abilities, we share capabilities,
Yes.
but we're not financially integrated. So it allows doctors and hospitals even to maintain their independence.
Excellent. What are the emerging health problems that you're seeing a lot of these days? Since I've got you here, what kind of things have you been seeing change? I mean, we had a period where the methamphetamine epidemic was on us. Are you seeing some health problems emerge that are more prominent? What are you experiencing?
Well, there's a couple of trends I think that are concerning, and probably the biggest one is diabetes. We're seeing a definite trend, unfortunately, towards more and more diabetes in the community, and some of that is lack of education about what health habits we need to promote, but some of it also is the patients are just not aware of what's happening in their own bodies.
Yes.
They simply assume it'll be okay or I can fix it later. And that's really what preventative health is all about. It's about helping people adopt a healthy lifestyle. Just good nutrition actually is a challenge in the state. Food is not as cheap as it is in the mainland. Even though agriculture is a priority,
Right.
we need more fresh green vegetables where people can get to them easily.
Right.
And that would change the makeup of our bodies in such a way we'd be healthier.
Yeah.
So there's some public health issues we have to deal with. Unfortunately, there's been a kind of a slow trend toward less activity.
Yes.
But all the things the state is doing to create bicycle paths and opportunities for recreation, you know, we have beautiful weather. And well, I think the high yesterday in Minnesota was 11 below. You know, we have little excuse for not actually getting out and having fun. And that's how exercise fun, same thing is how it should be here.
Yeah.
But we need to see more of a trend towards more activity, eating healthier, and certainly education to help people avoid these kind of things. I'm not aware of any other serious illness kind of trends. We'd like to educate people about the dangers of drugs,
right,
and try and really keep our youth away from that kind of stuff, because it'll destroy your health in a very short order.
But it's so pleasing to me to hear you speak kind of the language of the family practitioner, because I mean, that was my life for many years, and to hear you talk about nutrition, exercise, prevention, sensible choices about substance abuse, that, you know, that really is the bedrock of health in society, and I think that we often have gotten away from it. I don't despair, though, because there was a revolution of exercise in the 70s when people got into jogging, and there have been periods of time where we've become more aware about health challenges. We see initiatives and movements about home gardens and shared gardens, and these things, sometimes they seem small, but I think that actually they can have a very large impact on our communities and our lives. So the fact that you, as a physician running a health system, is focusing on those kind of things bodes well for the future. Why don't we, if I might, because we're coming to the end of this segment, we'll take a brief break, and then I really want to come back and say, what's your vision for the future, if that's okay with you, Dale?
Fantastic.
Okay, great. This is Josh Green, Healthcare in Hawaii. We finished 3 segments with Dr. Dale Glenn, who's an excellent family physician and leader at Hawaii Pacific Health.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Horry. Mahalo.
Aloha, welcome back to Healthcare in Hawaii. I'm Josh Green, State Senator and physician on the Big Island. Today I'm joined by Dr. Dale Glenn, who's a physician at Hawaii Pacific Health, family practice doc who runs his program and who's really been engaged in healthcare transformation. What I promised in our last few minutes was to turn it over to the doc and say, what's your vision for tomorrow? In many ways, just after 45 minutes today, and we already have had lots of time together in the past, I see this doctor as the doctor of tomorrow. He's already forward-thinking, he's changing things for the better, but I wanted to ask Dale, what's your vision of the physician in healthcare for the next period of time?
Definitely. You know, we see this trend in healthcare moving away from hospitals and clinics and really kind of centralized care to care that's really delivered at the workplace, at the home. And Hawaii Pacific Health and Hawai'i Health Partners are really about creating and driving that trend as much as possible by using technology, using teamwork, and really using a patient-centered approach, figuring out what is it that you need that's going to help you get the care and maintain your health. We want to bring that to you in a manner that's easy for you to access, easy to understand, that makes your life simpler so you're not spending all your time waiting in the doctor's waiting room, but actually bring this to where you are and deliver care that way. And so the trend is moving away from centralized medicine to really personalized medicine at your home or workplace, on your cell phone, home monitoring, tools that are much easier. The other big trend in healthcare is towards prevention. You know, our real goal is to keep people out of the hospital.
And it's really extraordinary because on several occasions I've watched you reach to your cell phone to show me an adjunct of what you're doing even for your own family and what you're doing in the healthcare system. But to hear you describe healthcare going out into the home and into the workplace, it's really fascinating for me because on the one hand, people might have that preconceived idea that it's a big health system, Hawaii Pacific Health. It's got 4 hospitals, it's got 49 clinics. I mean, it's got an institution sense to it. But you as a leader in the healthcare delivery system for Hawaii Pacific Health are actually about a service of taking healthcare to people. And I think that really makes you quite unique. Is there anything else you want to add? We've talked a little bit about your physician health organization, the PHO, recruiting docs to come and be a part of this movement. Is there anything else you want people to know about you?
Oh, just the final thing I think I'd say is this trend in medicine is, getting away from trying to pull people into our model and instead move out to find out what they need, and decentralizing medicine, helping people live the lives they want to live. That's what good health is all about.
Okay, well, I so appreciate you coming on today. We've had a really interesting dialogue here with Dr. Dale Glenn, who's a leader at Hawaii Pacific Health. They're rolling out new programs that take healthcare to the patients. They're focused on prevention, on nutrition, on the essential core parts of what really family practice and primary care has been all about. It fits well, it seems, with the Affordable Care Act. It fits well with the kind of feeling that we have here in Hawaii as the health state, caring for our loved friends and family. It's no Hana health system, and it's really an interesting thing to hear it directly from one of the directors over Hawaii Pacific Health. So I thank you for joining me today. I wish you well. I think it's going to be a great adventure.
My pleasure. Thanks for the opportunity, Josh.
You
Good
bet.
talking with you.
You too. I'm Josh Green, Healthcare in Hawaii, your host. Thanks for joining us. See you again soon.